you. What Neera quoted was actually not price growth, that was spending growth. And spending growth is the combination of price times volume. So she's right that in 2014, we did see spending growth increase. And a large part of the reason that we had that, again, was new treatments for hepatitis C that are curing a disease that kills 5 times as many people as HIV/AIDS, that was going to cost our healthcare system $80 billion over the next 20 years' time. If you look back at the entire last decade in terms of spending growth for prescription medicines, we were less in terms of spending growth compared to hospitals, compared to doctors, compared to home health care. If you look going forward over the next decade, we're expected to spend $2.4 trillion more on healthcare in this country. 85% of that additional $2.4 trillion is attributable to hospitals, doctors, home health, nursing homes, everyone but prescription drugs. We're about 15% of that increase going forward.
Let's let Ezekiel.
It's always everyone else. Let's get clear on 2 important points. One of the reasons patients are non-compliant with their medications, a very large reason they're non-compliant with their medications, is prices, because prices are very high. Just take the diabetic example that was given before. Insulin in the United States, non-discounted price, $372 for a month of treatment in the United States compared to $46 in France. Januvia, another drug for diabetes, $330 in the United States compared to $35 in France. That's a major reason for noncompliance. The second point I want to address is they're saying, look, all we need is competition. But the fact is, you get a lot of competition in the drug market, and it doesn't necessarily drive down prices because, as I mentioned before, doctors don't know prices. Here's an article from JAMA just this August. Competition between 2 or more brand name manufacturers selling drugs in the same class does not usually result in lower prices. For example, consider the statins for cholesterol. We had 6 that were off patent and generic and 2 that were on patent, and the price for one of them on patent increased 91% from $112 to $214 per prescription, and still sold the last for AstraZeneca. Prices doesn't matter on competition in the healthcare marketplace.
Lori Reilly.
Yes.
Because patients are not buying them.
Lori Reilly.
Thank you. Part of the issue that Zeke is pointing out has to do with how insurance companies treat cost sharing for medicines relative to any other part of the healthcare system. Today, patients are asked to pay on average 20% out of pocket for their prescription medicines. Compare that to hospital cost out of pocket, 4%. Physicians under 10%. So it's no surprise that when patients go to the pharmacy counter, they're asked to pay more for their medicine out of their own pocket, and that's how our insurance system works today. Zeke mentioned list price growth, and that's an important thing to remember here. List price growth is not the price that a PBM, one of those 3 large PBM, pays for a product. He specifically mentioned insulin prices. The net prices for insulin are cheaper today than they were 3 years ago. Cheaper today than they were 3 years ago. But part of the problem in our healthcare system is that we have a rise in high deductible health plans where today patients are being asked to pay out of pocket that list price. The payers, the health plans, are not providing those discounts back to the individual patient.